This is a live call-in show. I am Dr. David Randall, and this is Dr. Pet Show. You guys know every Tuesday, a live call-in show, 6 to 6:30. You got me for the next 28 minutes, and this is the first time ever this has happened. This is going to be a great show right here tonight, okay? Primarily, we're going to be taking dog questions, so if you have any questions pertaining towards your pet, give us a call, especially training. Right next to me is the lovely Sylvia Wilson. Yay, 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 yay. Sylvia and her husband, Danny, who's standing right behind us. He's such a big, bulky guy that we couldn't set three of us here on the table, but they are Bark Busters, okay? They started Bark Busters. I think you're in 11 countries, right?
7.
7 countries, but I can tell you this, 750,000 dogs cannot be wrong.
Yes,
okay,
and counting.
And counting stuff. So anyway, real quick, in about a minute, please tell our audience about Bark Busters.
Barkbusters started in Australia in 1989 after I'd spent 10 years as manager of an RSPCA shelter, where I just tired of seeing dogs surrendered for misdemeanors, and usually they were dogs in their prime. So we decided that we could help people, and 25 years later we're still here and still helping people.
They're absolutely. You've written books as far as training?
7 books on dog psychology, and writing another book very soon, and also a puppy training book.
Fabulous. I'm telling you, you cannot go wrong. Any problems you have whatsoever pertaining towards pets, what you think is misbehavior, and a lot of times it's not misbehavior, it's just
misunderstanding. Yeah.
A dog is a dog is a dog.
Exactly.
They're not people.
No, and dogs are people watchers, you know, and people don't realise dogs have got nothing to do all day but to watch what the humans do.
Exactly.
And when they do that, they learn so much about us. The trouble is the humans not catching on to what's wrong.
Exactly. We're going to train you guys today. That's what this is all about. I know we've got our first caller on the line. Hi, Judy. I'm Dr. Randall. I have Sylvia sitting next to me. What can we do for you tonight?
Hey, Dr. Randall, this is a question about Sky. I adopted her from you about 2 months ago.
Yes, ma'am. And tell the audience and tell Sylvia, Sky he's an American Eskimo, right?
Yes, she is. She's 5.5.
She called in last week and I told her to call today. Okay, 5.5-year-old American Eskimo. Go ahead. I'm going to shut up. I'll try.
Okay. Not knowing what her eating habits were exactly, I was feeding her just like I do my Maltese. And first of all, she wouldn't eat from the bowl. She wouldn't eat. So I thought, well, somebody said maybe she's used to eating on a plate or a saucer. So I put it on that. She still wouldn't eat. But so I kept moving it, and I finally put it on my bed, and I sat by her, and she'll eat.
Okay.
So she's not a big eater. She usually just eats 1 time a day. But I would really like for her to start eating
normally,
when the other dog does. So what am I doing wrong?
What I told you, and I said I wasn't going to talk, I just, what at least I told her last week, that she had to call today, okay?
Yeah.
And that I thought Sky has trained her very well.
Very well, exactly.
Very well. Now,
that's
I'm
what
going to
I
go
just
back.
said.
Sylvia, this is Judy. Please help her.
Hi, Judy. Judy,
hi.
One of the things I think that's, as David said, this dog's trained you very well. I would try starting with just doing some hand feeding, and then starting to get your hand and move your hand to a dog bowl. So she's eating off your hand and also where the dog bowl is. So she's going to learn by association that when she gets fed, there's a dog bowl there, and start introducing that. So start at the bed where you are, and then start putting your hand under the food and let it start to eat off your hand, and then start to lower that until you're actually on the floor and getting her to start eating out of a bowl.
And one thing that's right, I'm talking again. One thing at lunch today, Danny, her husband, all right, he said when you're having some of these issues, don't just make it a smorgasbord of food. Keep them a little hungry so that they know that they have to go back over there to retrain.
Exactly.
So you don't want to have, I think I got it right from Danny, I don't think you want to have a large meal there.
No, that's right, yes, because, dogs are creatures of habit, and if you start them off at a particular place, they will then try and control you. And what happens is, because we're human, we tend to humanize dogs rather than You know, and they're really dogs. But the thing, we have a saying that if you treat a dog like a dog, it'll treat you. Sorry, if you treat a dog like a human, it's going to treat you like a dog. So start to think of it as a dog, but start to do that transitional thing where you start off on the section where you're feeding the dog on the bed and then start to bring it down onto the floor, and lots of praise.
Lots of praise and very small meals.
Very small
Very small
meals.
meals,
Yeah.
and she has
She's
to
not a
realize.
big eater. I've noticed
Well,
that.
she's going to become a smaller
She will be
eater.
fussy.
Well, I know she won't starve herself to death. Is
No,
that
she
No,
correct?
they never do. And it's funny, people do think that. They say, oh, she's not going to eat, she's not eating today. But truly, you know, they never starve themselves. And when I look at the dog's shape and this body, I go, this dog is not starving. So
Okay.
you'll be
And I
surprised.
will be giving you a call because she is having some other little issues, but I won't tie the line up. But I will be getting a hold of you.
All right, thanks, Judy.
Very good. Mr. Glass will be waiting for you. Thanks, Judy, for your call.
Okay, bye-bye.
Bye-bye.
Bye.
That's how it works, okay? It's literally that simple. So if you have any questions pertaining towards your pet, okay? Now, we're talking dogs. We're not talking cats or birds or horses.
No, I mean, you know,
I know you've
they're
had
animals.
horses.
I've had horses.
Yeah, I know you've
and
had horses.
Had a bit to do with cats. Actually, my daughter's trained cats, and she does better than I do with cats. But you know, dogs my expertise.
Well, I'll tell you what. Up in Orlando, in Orlando, SeaWorld has a wonderful pet show that goes on. It takes about a half hour, and they have all these pets from the ASPCA, and they have birds, and they have cats, and they have pigs and dogs, and it is absolutely amazing. So you can train these other animals.
Of course, yeah.
But anyway, listen, we only have about 22 minutes left, so we're going to go directly to Gloria. I'm Dr. Randall. Sylvia's here. Miss Barkbusters, what can we talk about tonight?
Hi, this is actually Victoria. I have a 2-year-old female German Shepherd mix, and I rescued her about, I'd say, a year ago at the Domestic Animal Services. And she's not aggressive, but she starts getting really nippy when she gets too excited or when we try to not have her jump on people. And I have a friend with the canine trainer in the sheriff's office, and he recommended kneeing her in the chest, but I feel that's too brutal. Do you have any other suggestions?
All right, so Victoria, you've got a 2-year-old Shepherd, and she gets so excited she jumps up to you. She jumps on you?
Yes, and other people who come through the door.
Yeah, that's probably not a good thing.
No, it's not, and it can hurt you. And you know, the thing is, the dog doesn't really know that it's doing wrong unless you actually educate it. So, you know, one thing that I find works very successfully is to try and start educating your dog in other ways, rather than waiting till she's actually really adrenalized, which is what happens, and she gets excited and she's jumping. And like start to use like just a clap as a correction. So it's just bah. You can just growl, and
I
you've
gotta
probably
practice
heard that.
It's bah, right?
Yeah.
I do believe I've heard Mr. Glass do that.
You would have heard that. So it's just a dog sound. And really, if you think about the way dogs relate to each other, when a dog comes to approach another dog, it's a dog's way of saying stop, don't do that. So what a dog does is it will just growl, it goes, "Arr," and the other dog, if it's got any common sense, will just back away and stop. So, you know, you don't want to stop her from actually approaching you. So there is a fine line here. So I'm going to talk you through it. She comes running and she's about to jump. As her feet leave the ground, she doesn't have to be right up here, just as her feet leave the ground, stand your ground, stand up tall and just go, bah. And you will find that she will then drop down onto her 4 feet, and when she does, give her a pat and praise her. Say, good girl. Now, as soon as you do that, she's going to jump straight back up. So be ready to then again just give that clap and that little puppy growl, and she will get that. Because when mother dogs are dealing with their puppies, you will see that the puppies start to get silly, the mum growls, and the pups realise, hey, I'm not supposed to do that.
Did that help out, Vicki? Victoria?
Yes.
Did that? All right,
Try that.
let's try this together. On 3, you and I are both going to clap our hands and go bah. Okay, ready? 1, 2, 3, bah. You need a little more practice. A little more. Hey, hey, listen. You may find this a little funny, But when Sylvia said, you know how dogs greet one another, meet one another, you know what went through my mind? They go right to the hiney.
They do, but we don't want you to do
yeah.
that.
So she's saying that, and I'm sitting over here kind of biting my tongue, like, yeah, I can see where this is going. This is a nice television show.
That's
Okay,
right, but we don't want
anyway,
you to do that. But if you want to get that bar right, practice in the shower.
Okay.
So when
Okay.
no one's around and you won't feel silly.
Listen, don't worry about feeling silly, okay? The whole world is crazy, so I'm sure
yeah.
she's not. Thank you for your call, ma'am. Have a good day.
Thank you.
Bye-bye.
Jamie, who did you say the next caller was? Oh, this is fantastic. Guys, thanks for calling in, because I'm telling you, this is literally the world's top training in the world, okay? No matter what else anyone's ever said as far as dog training, this is why dogs are not euthanized, just because you guys. That's how good they are, okay? And I mean, it's ridiculous the amount of dogs that are euthanized, and you have all these people that want to spay and neuter all the pets and do all this stuff, and it really goes back to training the pets
Yeah.
properly.
And just treating them like a dog. And I don't mean you have to be harsh, it's just remember they're a dog and they have certain needs and they're going to just keep trying you.
are.
And, just get to know their language and speak dog and you'll
That's
find
right,
it
speak
easy.
dog. Marianne, hi, I'm Dr. Randall. We have Sylvia here, Wilson from, she is Miss Barkbusters. What can we do for you?
Hi, Dr. Randall.
Hi.
Hi, Sylvia.
Hello.
Yes,
Hi,
I have a terrier mix. He's about 5. We've had him about 5 years old, and he's a rescue. And I feed him and do everything for him. But recently he started snapping at me and biting me. And I don't. I think it's when I want him to do something, like if I have to go somewhere and I want him to go out to pee, and I'm going to pick him up and take him out, he'll bite me. And it happens so fast that it's a shock to me as it is to him, I think.
Sure, yeah. Nancy, is it?
No, it's Marianne. No,
Marianne, sorry,
does your little terrier, does he bite anyone else, or are you just in the house
No,
by
I'm the
yourself?
only person.
But
He's
there's
biting the hand
other
that
people
feeds
in your
me.
house.
Pardon?
There's other people in your home.
Well, just my husband, and then
Well,
we have another dog.
Well, he
and,
counts.
He
He counts.
She
So in
forgot
other words,
about
there's
him.
2 humans and 2 dogs, and the terrier is biting only you, right?
That's right.
Fabulous.
Okay.
Now I got it.
You got it now.
I'm going to be quiet.
You're on the right track. Now, I just want to ask you, if he was a Rottweiler, would you be able to pick him up?
No.
No. See, part of the problem is he's a little dog and I think he's telling you don't pick him up. I think
really?
you're using the pickup because you haven't educated him to go outside. And, because they're cute and they're little cuddly dogs, and I say to people, look, I don't want you to stop actually picking your dog up, but you've got to learn to read the dog's signs. And if he's telling you he doesn't want you to pick up, see, dogs hit with their teeth, we hit with our hands. So, if...
I kiss. I'm not a hitter. I'm more of a kisser. Marianne, let me ask you this: if he's on the couch with you and stuff, does he sit higher? Does he sit on the back of the couch, or where does he stay?
Well, he does sit on the back of the couch a lot, but if I'm
Hey, are you
he'll sit
good
in
or
my
what?
lap.
You know what? Mr. Glass has taught me well. But if he's a terrier and he's biting her,
Yeah.
they're playing King of the Hill.
That's
And
right.
he's the King of the Hill right
Yes.
there.
And you started your sentence when you spoke to us is, I do everything for him. He does nothing for you. And that's the way this relationship is a bit unbalanced. So you've got to get some balance here. But, I would start with maybe clipping a leash on him when you want him to go out, and have a little harness on him so you can clip a leash, and you start to say outside and start to educate him.
And not a zippy leash, not one of those boing leashes.
No.
You need to have what, a 4 or 6 foot leash?
Yeah, nice little light leash because he's only a little dog, but something that's like a static leash, not one that actually. I've got to get used to saying leash in America because.
Do you know how many
we
of
say
my
lead.
clients have, Marianne? You would not believe how many of my clients, my mature clients, have had rotator cuff injuries from those zippy leashes and
Yes.
knee injuries, hip replacements
Yeah.
because they get tangled up and they fall down.
Check out the hospitals. Yeah.
Yeah, absolutely. So, I mean, the type of leash is really important. Doesn't have to be expensive, okay? even though I'm sure there are designer leashes out there.
I'm sure there are, and there are. But, you know, start getting him to just understand what you want, and don't panic him by trying to pick him up.
Okay.
Educate him that you want him to go out. Obviously, you haven't got a fence. I'm taking it. He can't go out, or does he not want to go out?
I have a fenced backyard, and
Okay.
and he's always gone out. But sometimes if I'm going to be leaving, or I've got something to
I
do,
know,
and
yeah.
I need him to go out just as a precaution,
Sure.
not to go when I'm gone.
Yeah.
And he'll do that. But sometimes he doesn't want to, and that's when he snaps at me and
Yeah.
bites.
Well, that's him telling you, I'm not going out. You know, if David's trying to drag me over there and go, no, don't do that. It's, you know, people hit with their hands, dogs hit with their teeth. So that's what he's telling you. But the thing is, you've got to come with this training from a position of strength. Get a little leash, clip it to his harness or his little collar, and then just say outside and start taking him outside. He won't be able to bite you if you do that.
Marianne,
right.
do you live in Lee or Collier County?
Pardon?
Do you live in Lee or Collier County?
Collier.
Okay, listen, I guarantee you that if you hire Mr. Glass with Barkbusters, probably one single visit at your house, and this will be over, okay? I would almost guarantee you that 1, 2, or 3 hour lesson, and you are going to love the response. I'm telling you what, if you hire Mr. Glass and if you're not satisfied, I'll pay the bill, I'll reimburse you his charge. How about that?
I know about your promises, Dr. Randall.
Ooh.
That sounds like a good deal.
That is, okay, yeah, because that's my promise. I stay behind my promises. I guarantee.
I know you do. I know.
That's a guarantee. If you call Barkbusters here in Collier County, you hire Mr. Glass. If you're not satisfied, I guarantee you, I personally refund your money, because I know he's going to keep the money because he did a good job right there. But anyway. Please hold them. And then what about the thing in the back? She's got to stop the dog from getting up fast.
Yeah.
That's got to end.
Yeah, and what I would do too, does he sit on your lap sometimes?
Yes. Oh, he sits in my lap every time I sit down.
All right, but so what about you start doing just a little bit of letting him know that who pays the bills around there, and when you sit down and he jumps on your lap, stand up. And just let him slide off your lap, just onto the lounge, and then sit back down again. And then if he comes to try and get on your lap again, stand back up again. And just start to put in place some little exercises that let him know that you're the boss around there and that you pay the bills. And he will start to look at you in a different light and stop biting you.
Marianne, isn't she lovely?
She is. She really is.
I'm telling you.
I saw her when you first came on.
I tell you what, we went out to lunch together today. Of course, her husband was there. And but anyway, it was a lovely lunch. Anyway, if you call Barkbusters, you're going to be real satisfied. That's going to be the answer. Okay, Mary?
All righty.
Thank you. Have a good day.
I'll
Bye.
do that.
Denise, hold on. We're going to take a short break. We'll be right back after this. I'm Dr. David Randall for Big Cypress Animal Clinic and your doctor for pets. I want to introduce you to the iTherm, a non-invasive, fast, effective healing, rehab, and pain management system. This is Kevin.
iTherm is molecular hyperthermia. It can treat a variety of disorders ranging from cancer, arthritis, hip dysplasia, soft tissue management, wound healing. Very simple, non-invasive.
And it works.
It works. Highly efficacious.
It works. Now exclusively at Big Cypress Animal Clinic. All right, I'm Dr. David Randall. This is the Doctor for Pets. Every Tuesday, 6 to 6:30. It's going to repeat at 8 o'clock every night this next week and at noon every day the rest of this week, okay? So if you missed it, watch it. It's absolutely fantastic. Next week is also another call-in show, okay? But this is the first time that I've ever had the opportunity to have such great trainers that are here. Danny and Sylvia Wilson from Barkbusters. They started it. They wrote the book. This is how we save lives right here. I'm going to our next caller, which is Sandy. Hi, Sandy. What can I do for you tonight?
Hi, Dr. Randall.
Hi.
I have a 1-year-old poodle, and she's a great dog. I've trained her to sit when we meet people, but she always seems to piddle just a little bit when we do this.
Mm-hmm.
I don't know if it's submissive urination. I don't think so. It seems more like excitement. What do you think?
I'll tell you the medical part of it real quick and stuff, then I'll let you take care of it. Please tell me at 1 year of age you have not spayed her.
No.
Fantastic. Okay. The reason being is that everybody needs to have hormones. Girls need estrogen, boys need testosterone. And you never want to spay this pet until at least it's had several heat cycles, and then spay them, okay? Once their joints are closed, once their bladder's mature, say it's a year and a half of age or 2 years of age, 2 cycles, then spay them, and that'll be fine. So I do not think that it is a veterinary question. I think it may be a training question.
I think so. I think you're putting a little bit of pressure on this dog. Is she a shy little dog?
Yes, she is. Very
Okay.
shy.
See, she knows what's coming. She goes, this is when you make me sit and people are going to pay attention to me and they're going to maybe want to pat me, and now she's becoming really worried. And you're putting a lot of pressure on her. You know, Danny and I both, when we travel anywhere and we meet dogs for the first time, we always let the dog instigate the greeting. And where we live, actually, we see lots of dogs. And I've seen people with dogs that are shy, and the first thing the dog does when it sees people is duck behind the owner. And we just stand there and say hi to the owner.
Sandy, let me ask you this. When you're in your house and she's got free run, if I walked into your house or somebody walked in your house, will she do the same thing if I don't pay attention to her? If I just walk over there, where would I walk? I'd walk to your bar. No, I'm sorry. I'd walk to your kitchen.
You know where your mind is.
I'd walk in the kitchen, and if I didn't pay much attention, would she piddle then or not really?
No, she wouldn't.
Yeah.
It's a good question. Actually, it was a good question. So you see, that's what's putting the pressure on her. That's telling you, she's telling you, dogs tell you a lot. So, you know, as I said, when we run into someone who's standing with a dog and the dog goes behind them, that's not the dog instigating a pat. A dog that instigates a pat's a dog that comes up, hello, 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 that kind of dog. The dog that you've got is a dog that really is very shy, and she's going, oh no, this is the time, this is a part where they actually pat
I think
me.
Sandy probably wants to show off because Sandy obviously loves her. So Sandy's trying to do the best thing, but then she's having this thing.
True.
What should she do then? Just try to stop this for a while, wait until she's more mature?
Don't make her sit. Let her, and actually try and get people to just ignore her and talk to you. I know that's hard because she's probably so cute, but all you're doing is putting a lot of pressure on her. She's actually a dog in need of space. There is a thing called Dino dogs out there.
I love dingoes.
Not dingoes, it's Dino dogs.
Oh, Dino dogs.
Which means dogs in need of space. Some dogs are like people. You know those people who go to a party and they sit in the corner and they've got the quiet beer and they go, oh, wish I hadn't come. I wish the world would open up and swallow.
That's not me. I can assure you that.
That's not, you're a party boy, but we have dogs that are not party boys.
Exactly. Sandy, does that answer it for you?
Yes, it does. Thank you so much.
You're welcome. Thank you.
Okay, bye,
Hey guys,
Sandy.
time is just rolling through. We'll be right back after this short break. Stay tuned. Dr. David Randall here. Welcome to Big Cypress Animal Clinic. Big Cypress Animal Clinic is on East US 41, Naples, Florida. It's a member of the American Animal Hospital Association. Big Cypress Animal Clinic is a full-service hospital. Puppies, kittens, and all your adult pets' needs. Boarding, bathing, x-rays, surgery, blood work, right on the premises. Come in and meet our professional staff. We have Dr. Carrie Portu, Brother Barry back here, and all the other professional people that work here at Big Cypress Animal Clinic. Come in. I can't wait to see you soon. Good day. I'm Dr. David Randall for Big Cypress Animal Clinic and your doctor for pets. I want to introduce you to the iTherm, a non-invasive, fast, effective healing, rehab, and pain management system. This is Kevin.
iTherm is molecular hyperthermia. It can treat a variety of disorders ranging from cancer, arthritis, hip dysplasia, soft tissue management, wound healing. Very simple, non-invasive.
And it works.
It works. Highly efficacious.
It works. Now exclusively at Big Cypress Animal Clinic.
G'day. Does your dog have a nickname? If your dog's behavior keeps you inventing new nicknames, remember this name. Barkbusters, the world's most trusted dog trainers. They'll transform your dog into a happy, obedient companion in just 2 hours in your home and provide a lifetime guarantee. Rate your dog's behavior at barkbusters.com. Barkbusters, training dogs the Aussie way.
I'm Dr. David Randall, a second-generation veterinarian at Big Cypress Animal Clinic in Naples, Florida. I recommend FlexPet because it's the most complete natural formula available for joint health. Pets love the taste of it, and FlexPet works. It's great stuff. Come into Big Cypress Animal Clinic in Naples, Florida, and pick up a bottle of FlexPet.
Call today for a special introductory offer. That's 1-888-END-PAIN. That's 1-888-END-PAIN.
I'm Dr. David Randall. We're so lucky today to have Sylvia here, Sylvia Wilson. She is Miss Barkbuster. Her and her husband, Danny, invented this 25 years ago, right?
Yes.
And they absolutely positively wrote the book, okay? So I know we only have a few minutes left on the show. We're going to go right to our next caller. Hi, Chris. I'm Dr. Randall. What can we do for you tonight?
Yes. My name is Chris, and I have several issues.
Okay.
I have a dachshund that we just got, and she shakes all the time, and when you go to pet her, she doesn't want to be touched, and she's very, very overweight.
All right,
Someone
Chris.
referred me to you. They said they took their dog to you, and you're a very good doctor. That is why I'm calling. I really don't know what kind of hard food to give her for her weight.
All right, Chris, let me do this. If you make an appointment, I'll do it. I know I'm going to introduce you to, she's talking about a fat dachshund, okay?
Yeah.
I'm going to introduce you to a liquid that we give her every day in her food, and she will absolutely positively start losing weight. It's very safe, and it's a liquid that will make her lose probably 5 pounds within the first 5 months, okay?
Okay.
And it's very, very effective and stuff. As far as that, do you have any other callers back there, Jamie? All right, so let me do this. You make an appointment at Big Cypress Animal Clinic. Remind me that you called on the show, and I'm going to go through your issues, because right now I want to try to finish up with Sylvia Wilson, the dog trainer. Okay?
Okay.
Okay. Thank you for your call. All right, Sylvia, we've got about 2 more minutes. What if you could just make a synopsis as far as what people should do with their dogs? What is the best way to train them? What should they do? It's all you, girlfriend.
Okay, I just want to actually just mention something about that last caller. The shaking that dogs do, that's adrenaline, okay? When they get adrenalized and they get concerned, they shake. So it's not that they're worried or fearful. Don't get confused about that. It's usually that they're adrenalized. So there might be something going on, and maybe Dr. Randall can have a look at that.
If
She's
we have
overweight.
a fat dachshund, that's an issue.
It is a
That's
bad
an
issue, yeah.
I guarantee you, if I can get 5, 6, 7, 8 pounds off that dog in a year, she'll have
Big
a whole
difference.
new dog. That
Yeah,
dog will
for
live
sure.
so long and be so much part of her life.
And much calmer too. So if I can say why we have issues with dogs out there, it's basically because people tend to humanize the dogs, allow dogs to just run the show, I guess, and it's like children. They're actually like children. They need education. If you don't educate a dog, you end up with a dog that doesn't understand your language, doesn't know what you're doing, and it's just going to behave like a dog, and it's going to try and train you. And that's what happens.
I think we've heard several of those already tonight. Okay?
Exactly.
The dogs training the owners.
That's it. And we love our dogs. We all love our dogs. So we pander to them, and we do what they want us to do, and that tends to cause a lot of problems out there. Look, there's lots of dogs, you can spoil them rotten and it makes no difference. They're still a beautiful, well-behaved dog. There's some dogs that are that little bit more cunning, and they'll actually
Sylvia,
try
I
and
want to
rule
thank
the
you
roost.
for coming on the show
It's
tonight.
It's a pleasure.
Danny, thank you for coming. Welcome to America is what I can say. Barkbusters, that's where it's at. I will see you next Tuesday, 6 o'clock. More veterinary calls. Call me up. See you then.
Bye-bye.
Good day.